Hello everyone, this is Dr. George Gonzalez. I'm the founder of Quantum Neurology and the author of the Holographic Healing Series. And I'm so excited to be here with my very good friend, David Vlasuk. He's a chiropractor in Seattle, Washington area. And he's going to be presenting at our homecoming event, November 11th and 12th, here in Los Angeles of 2016. And he will be speaking on concussion and non-head injury concussion. Thank you so much for being here, David. How are you?
I'm doing great, thank you. Good to be here, George.
Absolutely, and you know, this topic is very close to my heart because I personally had this issue, and this is where I've been tremendously helped with all of our practitioners that have worked on me, but especially when I came to see you. So just to let everybody know, I fell down, I fell on the stairs, and I broke my tailbone pretty severely. And I was damaged pretty badly, and it caused a lot of problems that I didn't understand. I thought they were from pain. You know, I couldn't see clearly. I couldn't read like I used to read. I couldn't process information. And I thought that I was light, foggy, and those kind of things because of the pain I was under, not because of the concept of a non-head injury concussion. And so when I saw Dr. David Vlasuk, he educated me on the concept and worked with me. And I had a tremendous healing experience where, you know, the veil was lifted, the fog was lifted from my mind, and I was able to think clearly, and I'm back now. So, you know, thank you so much, David, for doing that and bringing me over the edge. And I wanted to share this idea of non-head injury concussion with people. So could you talk about that a little bit?
Yeah, it's not non-injury concussion, it's non-head injury.
I'm sorry, I misspeak. Not head injury concussion. That's right.
Right. Well, there was an injury, but it just was an injury not to the head. And so we typically think of having to have something actually hit on the head in some direction before we start thinking concussion. But we tend to completely forget that the entire brain is held in place by the dura, and that the dura is completely non-elastic, very, very tough membrane. It simply does not have any elasticity to it, and it forms divisions in the brain. It connects the brain to the skull bones, and then it goes all the way around the spinal cord, goes down to the bottom of the spinal cord, and through the lumbar spine and connects on the sacrum. So George, in your case, where you landed with your full weight right on that sacrum, the tendency is to think of sacral injury, and there you certainly had that, you know, a big chip of the sacral bone sitting out there detached now. But we fail to remember that that shock of that hit did not just stop at the sacrum or at the sacroiliac joint or the hip or just the lumbar. It actually caused that very, very strong, tight dura to go, all of that shock to go right up the dura, up into the brain, and actually shock the brain through the dura. And that's the piece that is typically not considered, not thought of. And then knowing how to work with that's a whole nother approach. But that's basically what happened to you.
You know, when you first explained that concept to me, and like you're mentioning, I did not know that concept, that you could have a concussion from a tailbone injury or another area of the spine shooting up to the brain, so to say. And I thought of the carnival game, you know, where you take the hammer and you sledge the thing and it pings the thing up to the top bell and dings it. And that
rings your bell.
I'm sorry?
It rings your bell.
It sure did. It sure did. And at first, like I mentioned, I thought it was because of the pain that I was under that I couldn't focus and I couldn't read and concentrate. But as time went on, those things persisted, and I was getting better physically, but my mental faculties were not, until you worked with me. And so you did an extensive evaluation on me, and you did a lot of quantum neurology with me, but you also have a specialty in sacral occipital technique. Could you describe that for people that may not be knowledgeable about that? And you know, that's why you're so specific about the dura and those kind of things.
The sacro-occipital technique, which was developed by Dr. DeJarnette, is basically a treatment protocol that involves, among many other things, using blocks or wedges under the hip bones or under the tailbone to create forces up into the spine, up the dura, and into the cranial bone mechanism. Sacro-occipital technique definitely recognizes that cranial bones move, that they move in conjunction with respiratory cycle. And when something inhibits that movement, the proper movement, then the whole nervous system is compromised. So from the sacro-occipital technique protocol, working with the hip bones, working with the sacral bone, is affecting the cranials. And then Dr. DeJarnette went on to develop cranial bone movement techniques to enable the cranial bones to start to function again with respiration as they're designed to do. So that's kind of the basis of sacro-occipital technique. There's many parts of sacro-occipital technique that involve just the spine, hips, tailbone, but then there's a whole nother segment that involves the cranial bone adjusting or cranial bone movement and work with that.
And the work you do with the dental and the occlusion, what's that referred to as?
When Dr. DeJarnette talked to us about how the whole body is integrated and interrelated, he would frequently make the concept that when we're doing something over and over again and not getting anywhere, he would make the comment, don't forget to look to the teeth. That was his comment. But that's kind of where he left it. That's as far as sacro-occipital technique in and of itself ever went with the bite and the teeth. And then one of Dr. DeJarnette's proteges, Dr. Bob Walker, was a student at the time, and Dr. DeJarnette asked him to take that whole concept and develop it, which he did. And so out of that came a group called chirodontics, where chiropractors and dentists came together and started studying and looking at how, if the bite was off, the tremendously powerful muscles of mastication that attach onto the jaw and then attach up onto the skull bones have tremendous leverage and force. And we oftentimes use the example, take an ice cube and try to crush it in your hand. Good luck. Pop that same ice cube in the back of your teeth, and these powerful muscles have the ability to quite easily crush that ice cube. Horrible for the teeth maybe, but we've got that power to do it. And if the bite is balanced the way it needs to be, those muscles pulling on those cranial bones work just fine, cause no problems. But if the bite is not right for any number of reasons, and those powerful muscles are pulling every time we chew on something, then one side is pulling a lot harder than the other side, and it can over time begin to torque the cranial bones into a locked up position. And along with the cranial bones, then there's a torquing or tightening abnormal pressure on the dura, which then affects the circulation throughout the whole brain.
So now when, you know, all those things are fascinating, and they're a completely different subject than I've ever studied. And to feel it firsthand and the effect of these changes, it's tremendous. It's tremendous benefit. And one thing that I want everybody to know is as powerful and as amazing quantum neurology is, and we hope for it to be 100% result for a person, it's often there's other areas that need to be addressed. And this is an example of the dental work or the cranial sacral work, which is a great conjunction with quantum neurology in helping certain conditions improve beyond what quantum neurology can do by itself. Now, you know, Dr. Vlasuk, I think you're the perfect person to explain the difference between cranial sacral work versus quantum neurology cranial work, the cranial nerve work. Could you describe the differences between the two?
The SOT cranial work is, as I said, getting the cranial bones to move in their natural, normal type of respiratory motion. And with that, we increase the cerebrospinal fluid to areas of the brain that previously had not been getting its fair share of oxygen and nutrients. And so that's a basic need of the brain to be able to begin functioning normally. And there are some wonderful results that happen, as you experienced, just from getting that oxygen and the nutrients opened up to areas of the brain that have been very restricted. And then if all of the other cranial nerves are intact and working well, we're, quote, home free, unquote. But as we know with quantum neurology, even when we have those kinds of normal movements of the cranial bones, normal functioning of the cerebrospinal fluid pumping, etc., there are other factors which can cause inhibition of those cranial nerves, and that's where the whole quantum neurology cranial nerve assessment and rehabilitation protocol really shines. So if the spinal fluid and cranial bone motion that provides that spinal fluid to the brain areas is not able to function fully, then we are going to have some degree of limitation in how far we can take those cranial nerves in their rehabilitation process. It's just going to be restricted how far we can go with that. So we need both. Either one by itself does have its limitations.
Now, not being experienced in SOT, you know, or maybe somebody who's listening isn't experienced with SOT, how common is the cranial, you know, do we call it cranial faults or
cranial faults?
Misalignments?
Cranial faults is a good word. Ask again.
How common is that of a finding on people? Like, does everybody need this, or is it 1 out of 10, or what would you say is the necessity for the SOT cranial type work to be done?
If we're looking across the population, just taking a cross section of the population, there are many, many people who do not need cranial bone manipulation, SOT type of work. I get the skewed perspective because almost every patient that I see has already been through traditional kinds of care by any number of different professional approaches and are still having problems. So in my particular practice, or in my experience, there's a great number of patients who need some degree of cranial release, cranial movement reestablished, and those are the problem patients. That's why they didn't get taken care of with other treatment attempts that they had made, you know, with other types of treatment protocols. So it's kind of a two-sided answer to your question. when we have patients who just don't respond well, they respond somewhat, but they don't hold their treatments. They very easily get re-injured. We do the nerve rehabilitation, but it doesn't seem to last very long. That's when it's probably a good idea to reassess and see if the brain the parts of the brain that are supposed to be sending signal to those areas we're trying to rehabilitate is actually able to get the full healing power going. And I would say that in those kinds of patient populations, probably a good number of them would benefit from cranial support, cranial bone treatment support.
Excellent. You know, it's one of those things, and just so we could help educate everybody, anytime there's any sort of head injury, of course, we would have to be looking at that as an option. Any spinal or pelvic injury, we're going to have to consider the cranial shifting in the cerebral spinal fluid if the patient's not improving. So these are definitely ways of helping cases when no other things are showing benefit, or when we've plateaued. We may need to look at these options as issues to help the patient further. And just correct me if I'm wrong on this. I want to just try to clarify this for people. So the SOT work is an external technique working on the bones of the head that are affecting change through the shifting of the pressures and the way the cranial bones are sitting. And quantum neurology is what we call correcting the software of the communication of the cranial nerves. So you're getting the benefit of both the outside in as well as the inside out approach, which I think is extremely powerful.
I would agree with that completely. Yeah, very much so. And then when we look at how we affect the hardware fixing part of the approach, I'll relate the experience I had when I was attending the sacro occipital technique courses with Dr. DeJarnette working with us. We had a session where we were going to be learning how to treat stroke patients. And so one of the doctors had one of their patients come in, and they had to pretty much lift him out of the wheelchair and onto the table. And Dr. DeJarnette told him to put him on his face. And then Dr. DeJarnette pulled up a stool and he sat down beside this patient who no one could really understand. His speech was so bad. Except his wife could kind of get an idea what he was trying to communicate. So Dr. DeJarnette sat there, plopped his hand on the guy's backside, right on his rear end. Of course, later on we found out it was right over the sacrum. And then Dr. DeJarnette started lecturing to us about things that had nothing to do with stroke, had nothing to do with cranial anything, all real nice information. But after 45, 50 minutes of lecturing, just straight on, he said, well, we're kind of done for the day, and got up and walked off the stage. Well, this continued to happen for about 5 or 6 consecutive days. These were 10-day long seminars at the time. And about the 8th day, this patient was able to start to get up out of the wheelchair and kind of hobble a step or two and get on the table himself. The 9th day, we were going in to eat lunch, and I walked up to this fellow. He was in his wheelchair, and I proceeded to talk to him. And yes, he talked with quite a slur and all, but I could definitely and easily understand what he was saying. And he was now starting to eat himself, which he had not been able to do for something like 6 years, if I recall correctly. And every single one of those days, the only thing Dr. DeJarnette did is sat down and put his hand on the guy's sacrum. And later on, someone had the nerve to ask Dr. DeJarnette, well, okay, but when are you going to start talking to us about how to treat stroke? And he was most irritated. He said, well, haven't you been watching? He said, that's what we've been doing. We totally didn't get it. He said, well, you never want to just start manipulating the cranial bones when someone's had a stroke, he said you do it through the sacrum. And what he was doing is feeling the tension through the tailbone of the dura going right up into the head. And by the 8th day, had that individual so that he was starting to feed himself, talk clearly to us. That's the power of dealing with the hardware of the whole system. And that's the hardware that got messed up royal when you sat down on it the wrong way on the edge of the stair. And that force that Dr. Deschanette was very gently using over about 8 hours, 9 hours, correcting this individual's stroke issues, you did in a split second with a tremendous amount of force, and that's what went right up the spinal cord, up into the brain, yanked on that dura in such a way that it just shut off big parts of your brain function.
It hurts when you talk about it. You know, it was such a devastating fall, and you know, I passed out several times, you know, right after it happened, as well as on the ride to the doctor's office that morning. You know, I passed out several times, and that was before we understood it was broken and those kind of things. It's such a tremendous healing personally that I've experienced, that it just makes me feel like, wow, this is something that a lot more doctors need to know about. If they don't learn it themselves, they need to have somebody like yourself to refer to for these situations. It's so powerful. And how do people come to see you, David? You know, I know you have a very busy practice and you have a waiting list practice, but if somebody was so inclined to come see you, how would they get a hold of you and come visit?
You know, the best way right now to start that process would be just to call the office. The front office would give you the information needed to get started with that.
What's your phone number?
The phone number is 425-455-9580.
Excellent. Thank you so much. And we're going to continue this conversation in the November 11th and 12th event, the homecoming event for Quantum Neurology. And we're going to have several other speakers, including myself, including Dr. Bob Hoffman, Dr. David Pascal, you know, Dr. Vlasuk, of course, many other speakers with amazing concepts and understanding, using quantum neurology in their practice to achieve amazing results in conjunction to the successful things that they were doing previous to learning quantum neurology. Thank you so much, David, for being here today, and I look forward to seeing you here real soon.
Glad to be here. Good talking with you, George. Have a good day.
Absolutely. Thank you. One last thing, if you want information about our homecoming event, you contact us at info@quantumneurology.com, and we hope to see you there. This is an open event. You could, as a doctor, you could come, of course. You could bring your staff. You could bring your spouse with you. So everybody's welcome to join. So thank you so much. And thank you, David, so much. I look forward to seeing you soon.
You're very welcome. Bye now.
All right, bye now.